Watch Before Surgery series. In this video, Dr. Abbasi is going to be describing the natural history of the spine.
So this is Dr. Abbasi with IS Life. I'm going to give you a presentation about the natural history of the spine, what to expect, and how to get the best out of our spine. And this is an important kind of topic because by the time you're 50 years old, there's only 30% chance you don't have spine problem. By the time you're 70 years old, there's only 1 to 2% chance that you don't have spine problem. So listen carefully because that will have impact on your personal life. Imagine we have a chart here, and this is our age. We are born at 0. Hopefully after a wonderful life, we are gone when we are 100 or more. And these are the graduation of our life, 10, 20, 30, 40, 50. And this is 100% of our spine capacity, meaning that we are at the best we can be. And surprisingly, people think you have the best kind of spine or musculoskeletal system or activity when you're in your 20s because they see most of these athletes in their 20s. But what they don't understand, those athletes need lots of skill. They need lots of practice. Most of the practice is actually when they are teenagers. If you really want to know when you have the best spine capacity, look at the Olympic gymnasts. They're actually in early teens. So your maximum spine capacity is actually in your early teens, and we all know when you're born, you have barely any function, and when you're gone, obviously your spine has barely any function. So we know that it starts with 0, goes up, go down. The top is actually in early teenage time. So this is a natural history, and when we get older, obviously our spine capacity goes down. Now, I think it's important, and you should know, and that this 100% is for every person is different. So you can't push it up and down. Like send your kids for sport activity, let them be active because whatever they achieve, it's their 100%, and from that point it's going down. And meaning that if you have somebody who's a potato couch, that start maybe here or here. So that means in the same age, they have less capacity. That's why it's important to send your kid for the sport. Now I'm going to put as well a line here. Now that you understand what this is, most of us are truly independent. Even if we have like only 25% of our spine capacity, that independent line here is really what's important. You want to do things when you're old, when you want to be able to enjoy your life. You don't have to do rock climbing or do Olympic gymnastics to do that. Now it makes sense that if you have a higher spine capacity, it takes you longer to drop below the line that you need help. But there's another important fact that healthy spine habit push your curvature that way. With the healthy spine habit, your curve looks more like that. With less favorable spine habit, your curve goes this way, meaning earlier in life you become to a point that you are depending for daily activity. That is important. Ambulation is important. Our body is made for it. Meaning that if you are below the line that you need help but you don't get it, you're not ambulatory, you're going to decondition. You're going to literally, your cardiovascular, your heart and your lung are going to decondition, meaning that from the moment you go down here to the point that you have a heart attack is not that long anymore. So this has actual effect on how long you are going to live. But let's say this is a normal spine development, and you have a good spine, you start living, but all of a sudden, now you have a problem. You have a medical problem, like spondylolisthesis, meaning bone is moving the wrong way, or nerves are pushed by the material of the disc. Then your spine curve doesn't look like that. All of a sudden, at 45, your spine, you drop off the cliff. When you drop off the cliff, what we do as a surgeon, we correct the problem to move your curve back where it belongs. Now, it just happens to be that spine problems are mostly accumulated in the older age, meaning that almost nobody's spine curve look like that. A natural spine curve, because when we get older we have more problem, look like when you get above, we mostly start having that in our 40s, and then the natural spine curve look like that, because we all will have spine problem. So let's say now, this is the natural spine curve, and mostly this is because you have spine problem. You have a herniated disc, you have a spondylolisthesis or something like that. How can we move this to the what it should be without the spine problem, additional spine problem? Often we tell our patient when they have a problem, we wait because we are weighing risk versus benefit. And the open surgery is so risky, we tell this patient is not bad enough for the surgery, it's not bad enough. Not bad enough. We tell them you're too young. Too young. We say you're too big. We say you're too old. And we delay the care. That's what we do, because we don't want to hurt them. Sometimes it's just risky to do this kind of surgery. So by the time we truly give them a care, they're already falling down here. And when we provide them a care, and by the way, many of these patients, we tell them just go live with it. They never go live with it. They go and die with it because they cannot walk, they hurt the heart, the conditions, they have an heart attack, and the cardiologist, not the spine surgeon, have to take care of them. So they are risk-free to us, but if you just push them to a $500,000 cardiac ICU in the last 3 weeks of their life. So it's more expensive, it's worse for the patient, but this is practically what we do. So they don't live with it. Let's get away with this curve. That's not acceptable. So by the time we help them, finally we give them surgery, they will never catch up with the natural curve anymore, because not only the surgery is very invasive and destroys the back, but as well, they already have started the deconditioning process, so they cannot catch up. Now, what we do different here is that literally we have our protocol. Once somebody starts going down, we have a protocol that within months we find out what is going on. Can we help them without the surgery? And 90% of the cases we can. But if we cannot help them without the surgery, because the surgery, minimal invasive, for example, olive procedure, has much less risk, we are more likely to give them the option to get that surgery done. And by the way, by not destroying the back, now all of a sudden, we can put them back on a natural curvature of life without, and this is the gain of the surgery, by the way, after regular surgery. Now, we have a name for that. We call it QALY. This is a term we use in the science to say how much our procedure really helps people. Now, look at the difference between these QALYs. If you catch the problem earlier and put them on the path to get better faster, but by the way, by being involved with us, we are able to change their life habit. You remember we said you can have a better or worse life habit? So their curvature actually looks better even if they didn't have that problem. So truly we are able to push their curvature to a more favorable region, so they get even more benefit from that surgery. Now, I'm going to delete that and then come back to a point that is really important as well for people completely to understand. Let's say they have a problem, they fall off, we fix them, and now their curvature is better, and we keep them ambulatory, we keep them enjoying their life, but still we are not making them younger. as obviously is common sense. Now, patient had a problem here in this age, and then I meet them 5 years later. Not all the time, but sometimes I ask the patient, how are you doing? He says, yeah, the pain is gone, and the leg pain is gone, the back pain is gone, but I still cannot do things I could do before my problem. Whereas the problem was here. And what that means, that they expect that from that moment where we did the procedure, actually that they have a disc curve, that they get better, go back in time, and our spine capacity get where it used to be, and even better. They want to get better and better. We have a name for that curve. We call that the Benjamin Button curve, or from the movie that this person is born old, but it gets young with the age. This is a Benjamin Button curve. Benjamin Button curve, or curve of eternal dissatisfaction, because it's just not realistic for us to make somebody younger, and by expecting that, it's just you're going to be dissatisfied. Actual example of a real person is that the 80-year-old person, that the leg pain was gone, the back pain from 10 was 1 of 10, meaning that practically no pain, but he was very dissatisfied because he couldn't drive 600 miles on a motorcycle to Sturgis in a motorcycle rally. That is a Benjamin Button expectation and curve that we cannot realize. Having said that, what at the end of the day is important for us? To keep the people independent, and that's very achievable goal. That even a 90-year-old person, like an example of a nun that needed 3 people to take care of her, but after we moved her from here, that nurse or nun actually had a curve like that. We could fix with a 2-hour procedure, do a scoliosis, segmental scoliosis, and make her independent, much faster, much more efficient, with less risk. And this is an achievable goal. Now, coming back to our curve of the spine, we agree that this is the natural curve of the spine. But happiness of our life can have a very wide. It could be 100% happiness. Actually, most of the elderly, it's actually studied. When you get older, you are more satisfied and happy with life because you don't have to prove yourself and so on. Now, the problem will become if you have only 5 hobbies and you cannot do any of them when you're older. And then literally your happiness in life, if you cannot, once you are getting in this area and you have 5 hobbies, you cannot do any of that, you will be dissatisfied. But what about if you have 100 hobbies that you still can do 10 of those hobbies? And that is where it's very important, like what we do in IS Life, we want to catch you here. When you're young, when you're active, we want you to have 100 hobbies here. So by the time when you come down, you still have 20 hobbies left that gives you joy in life. This is a realistic kind of way we can deal with the spine to keep you happy and keep you independent. That's very important. Now, contrary to some of my colleagues, that in that natural history of spine for them, what they are aiming is correction of one number versus another. I think for us, the goal is independency and happiness. And if we put these goals in, and we have to define that with each patient individually, but once we define those goals, we have to find out what is the kind of surgery. First of all, can we achieve them without the surgery? But if not, what is the kind of surgery that can give the patient that kind of return with the least amount of risks? So always smallest number of smallest surgery that can give people the maximum reasonable benefit. Thank you.